Some of you may be familiar with the actor Steve Carell from The Office and other movies. I've never been a fan of The Office, but I do like him in other movies. At any rate, he had a total hip replacement a couple years ago, and my producer asked me to do this reaction video to his comments on total hip replacement. So here we go.
And I hope this isn't too personal, that you had a hip replaced.
I did. That was a bad day.
That must be a pretty bad day.
Yeah, that was almost exactly.
So is hip replacement a bad day? It really depends. Every individual is going to have a different experience. For me, it was a very rough day and a very rough first week post-op. But what I've heard is that people who have bone-on-bone often feel immediate relief, like right after the surgery. So it's going to depend. I've also heard, by the way, of people who don't need a lot of painkillers and things right after the surgery. So all these things are going to vary a lot. For me, right after surgery, I really, did not request painkillers fast enough. And so when the anesthesia wore off, I was in excruciating pain, almost not able to think or talk. So that's one experience. And again, I hear from people who are just like, oh, I took a couple Tylenol and that's all I ever had to take and I feel great. So it's going to vary a lot, but some of you could have a very bad day. Now let's see what else Steve experienced.
A year ago, I had a hip replacement, a full hip replacement, and I held off as long as I could until the doctor said, hold off until you start to limp and then have a hip replacement. So I went in.
So that's an interesting point, and what you'll find is that different doctors recommend different things. Nowadays, total hip replacements using modern techniques and modern materials should last 20 or 30 years. So unless you're very young, the chances are that your hip replacement is going to last you for the rest of your life. And even if you need to have a revision done at some point, my surgeon told me that it is possible. There's enough bone in your femur. It's possible to have 2 total hip replacements done in your life. So that's like 50 or 60 years of use of an artificial hip. I can't imagine anyone running out. Now, it used to be believed, and with older surgical techniques and with older materials, that total hip replacements didn't last that long. They might last 10 or 15 years. And in those days, they certainly did say, wait as long as you can because, you don't want to have one at 60 and then at 70 and then at 80. That would be miserable. So I feel like that information was a little outdated, but, it's hard to know. And maybe Steve didn't have a surgeon who was employing all the latest techniques and technologies. Let's listen a little further.
My wife brought me in and Yolanda shaved my pubic hair, I'll just say it. Yeah. And, which I didn't know. I didn't know Yolanda was going to be doing that.
Okay, so let's talk about that. I did watch another reaction video reacting to this, and they said, well, if they shaved his pubic area, then it must have been a anterior approach. Well, I've looked at many, many incisions from all different approaches to total hip replacement, and I've never seen them get near the pubic area. And I don't know what size bush Steve Carell has, but I just can't imagine them having to trim that. That said, I don't know what was going on there, and I believe him. So they must have had a unique approach to this or, some other factor. But I did not experience that. And if you look at most of the incisions, they're like on the side of your hip. And I don't think most people's pubic area expands quite that far. So anyhow, in my case, they didn't have to shave a whole lot. And I haven't seen or heard of that happening very often. So I guess Steve is a unique individual.
He just decided, again, like the baboon, no one tells me anything. So the pubic hair is shaved, and then the doctor came in and said, so let's talk about your hip. What do you want it made out of? And I thought, this has been months leading up to this. And I'm about 20 minutes from having this permanent piece of body installed. And, well, you could go, it's like I'm picking out a car. Yeah. You could go with the titanium, or you could go, now, I'd recommend the ceramic because it's very, very durable. You might be able, it might last forever. However, it might squeak. That's the one down.
So when it comes to materials, my understanding is that the gold standard right now is titanium stem, a ceramic ball, and then a polyethylene cup, right? Because because that's going to give you the best wear. That those polyethylene cups have been perfected over many, many years. The materials show almost no wear after 20 years. That's what I've heard from some surgeons. And the ceramic ball is very, very strong and very smooth, so it provides for smooth operation. You only get the squeaking if you have a ceramic ball and a ceramic cup. So it's ceramic on ceramic. You can imagine what that sounds like. But with just ceramic on polyethylene, that should be fine. There are other options, right? Around the world, some people will do metal balls, metal cups, all kinds of things. And some countries may not employ the latest technologies. They may be trying to save money by using slightly older technology. But at any rate, what I had was that, right? So titanium stem, a ceramic ball, and then a polyethylene cup that the ball will go into, right? And my surgeon told me that that was the gold standard in total hip replacements. He did give me choices. He said I could go for ceramic on ceramic if I wanted, and he did warn me about that squeaking. And as someone who for about 40 years of my life had squeaky ankles and people could hear me coming down the hall, I didn't really want to get a squeaky hip and have the same experience there. So at any rate, let's see what else happened to Steve here.
Okay, do you want it to last, but do I want this?
Oh, by the way, I don't know what the deal was. I mean, if Steve's being honest and not just exaggerating for humor's sake, then I don't know what to say about his surgeon. But, surgeons like mine, I had conversations with him very early on about the materials that we used for my prosthetic. And really, I think my surgical process went very much the way that he had told me it would. And he provided me with copious amounts of information. He had me watch videos that he had prepared for all his patients to really help me understand the process. He even created this automated text messaging system that would send me text messages at different stages as I was nearing surgery and then post-op. And also you could ask it questions. So you could send a keyword and it would provide you information about that. So it was very cool, very transparent. He provided a lot of great information. I never really felt in the dark, although I will admit when you go through something like this, you always have lots of questions and you're never going to have them all answered satisfactorily. So you just hope that your surgeon has good bedside manners and is a good communicator.
Squeaky hip. so I went with the ceramic squeak hip. Yeah. And I said, give me the squeaky one. So they doped me up, and the guy doing the anesthesia said, now, do you want to see any of the operating room? Do you want to have any awareness from here on out? And I said, not at all. I want to be asleep for the next several weeks. Yeah. I don't want any recollection of this. So he gave me my medication, but it didn't quite kick in as quickly as it should have. They rolled me into the operating room, and it looked like a torture chamber. It was. There was a bed. There was the operating table. Looked like a spit, a rotisserie that you would roast a chicken on. And what they do is they put you on this, they strap you down, and they turn you around so they can get better access.
In wherever they need to go.
Wherever, to chop out the hip. And
so what he's actually describing is a bed that was developed for performing total hip replacements. And before the development of that table, it was a much more difficult procedure. They weren't able to do it with more muscle sparing and modern techniques. So that really revolutionized things. Now, there's no getting away from the fact that total hip replacement is a brutal surgery, right? I have not watched one yet because I don't think I could handle it. The closest I've come is there's one where a surgeon mom is walking her small son through doing it on a Play-Doh hip. And I'd highly recommend that video. It's very entertaining. It actually is very accurate and goes through all the steps, but it's using Play-Doh. So there's no blood, there's no flesh, there's no gore. But in a total hip replacement, it is brutal, right? They have your femur, they cut off the head, and then they have a big reamer that is sort of conically shaped, and they use that to ream out the center of your femur bone. And then they take the stem of the implant, stick it in there, and they use a hammer, and they bash it in there. And it's such a brutal process that sometimes if they haven't braced you properly, it can cause damage to your knees and other joints as they're hammering that thing in, right? So It is not a benign process. It is, we think of medicine sometimes as being all clean and sterile. This is a pretty brutal process. There's a lot of blood and gore involved. But to speak to anesthesia, so again, the norm is a spinal block, which is an initial shot, and then something called propofol, which is also nicknamed milk of amnesia. And that allows you to be aware, yet not remember anything that happened, and thank goodness. I actually looked at the surgical notes after my surgery, and I saw that my surgeon was having conversations with me in the surgical theater, and I don't remember any of that, thank God. Evidently, this new anesthesia, propofol, allows you to be somewhat aware but not remember anything, and that is a blessing.
So I was freaking out, and I saw axe saws, and the last image that I had in my head was a woman putting on a helmet. And I'm not even kidding. It was a helmet with a huge, like a visor and a light. And I just saw these eyes, and then I went out in abject terror.
So there you have it. And I know every surgeon is a little bit different. Everybody's experience is a little bit different. So what did your surgeon tell you that was different than what Steve Carell experienced? Or what did you experience that was different from Steve? Please let me know in the comments. Thanks for watching. Merry Christmas. Have a great day.
It's your world and I'm just a squirrel trying to get a nut to move your butt.
Please subscribe now. You know you want to. And why not go nuts and set notifications on so you'll be notified every time I put out new content.